Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Hi, everyone. This is the Transforming Healthcare Coaching Podcast, and we are excited to be recording this on today. Actually, is March 18th. This episode will release next week, but we are recording on the Health Workforce Wellbeing Day by the National Academies of Medicine. And this is a day that is an annual commemoration of the progress that we are trying to make in the improved pursuit of healthcare workforce well-being and patient outcomes across the board. So that's what we're about as well here at Transforming Healthcare Coaching. Everyone in healthcare deserves to be well, and it takes a village to do that. And I'm excited to be here today with Dr. Grizelda Anguiano, one of our coaches at Transforming Healthcare Coaching, to talk a little bit about physician well-being and celebrate physicians as part of that team makeup. How are you doing today, Grizelda?
I'm great. Thank you. Glad to be here.
A lot of times we talk about clinician well-being. It's given lip service. There's all different types of system level resources that are given to healthcare professionals, especially physicians. And yet I often find there's a disconnect, sometimes with my colleagues. And I'm curious what your perspective is.
I mean, as far as it's so much easier to tell people than to do it yourself, but it's so much easier to be that model. And even with my own kids. So it's trying to walk the talk and the whole part of it.
What are some of the common things that in the clinicians and the physicians that you interact with?
Yeah, once a particular doctor is coming to mind, and she would be so frustrated with her patients that have diabetes or they're not taking care of themselves. Yet we were at the cusp of her burnout season, I'll call it. And we were having to go back into the simple things of self-care and sleep and just going back to the basics. And she was really beating herself up about saying, oh, I tell this to my patients, how could I have been so blinded? And I think that's where we go into that other phase of level 4 energy when we're carrying so much that we get that compassion fatigue. And now we've been working together for some time now, and it's really nice to see her on the other side. And how now not only is she taking time for herself, but it's amazing how she's able to discuss those things, even with her own kids who are in elementary school. So she's changed their routines of how to incorporate sleep and well-being overall, that now I see her pictures on Facebook and other places where they're by the water and just breathing and just practicing mindfulness. So it's pretty awesome to see that whole picture.
It's amazing. I know a lot of my colleagues are always so skeptical of mindfulness, and yet is one of the very few interventions that actually do work. There's so much data for over a decade that has shown in healthcare professionals, doctors, nurses, that mindfulness practices are one of the very few things that can help. And so whenever we have all this skepticism, where do you think it comes from?
I think back to even the training, that it's just get there, start pre-rounding at 4 a.m. so you can be ready at 5 a.m. for surgery rounds. And then it's just that, like, putting yourself to the side, that and you just, oh, this is the way it is. This is the way we go through medical school and residency. And even when through the transitions of cutting the 80-hour work week or those type of things where they started to implement, it's still hard to say, I didn't want to leave something for someone else, so let me just do it. It's my job, let me just do it. So I think it just comes even through the way we were trained, the way we were raised, the way that we think it's who we are and this is how it has to be. And I think that's the beauty of that I really learned through coaching is I'm still a choice. And I think it's having to learn and accept that it's to fill my cups that I could fill that of others sufficiently is really.
I love that. I think back, I remember when the 80-hour work week restriction came into place, and many program directors and many people in education, medical education, recognized that we just gave them back time and they are no better, no more intelligent. This hasn't helped. The only thing that showed us that we had to change our work hours and commitments, and that was at least one step forward. And at the same time, it didn't improve well-being in any way, shape, or form. And I think now with the last, I want to say probably a good 5 or 6 years, there's been a shift towards not just about sleep training and physiology and the impact of the shift work on trainees. We've also now begun to implement well-being curriculum. And I direct that for our training program. And there is a desire to increase the and change that narrative of what we're taught. And a lot of times, this, like you're saying, we structure work in a way that mandates that you do have to come in at 4 a.m. And there are these expectations for pre-rounding. And wouldn't it be magical if a day that an AI robot did not need you to ever pre-round? Wouldn't that be amazing?
It would, but I think there's still a learning process that I can appreciate from it. But I think it's the something to learn from, I think, the younger generation, and even just really the research that has come from all of the mindfulness and everything. And I think there's just so that we don't feel guilty or selfish about doing it, and really see that taking that time or approaching things differently actually impacts not only our lives, but the patients that we're taking care of. I think it's when it's coming around to the evidence and then we can truly believe it. That's awesome.
Yeah. It's so interesting that you say that, because just this week, Stanford released an article looking at their organizational well-being construct to see whether or not what affected well-being. And one of the biggest things was the culture of well-being. And it just goes to show that every individual person in the group, especially if you're a physician in a physician group, how your boss perceives and exhibits and talks about well-being, to actually have a discussion before we implement policy change, work structure change. I really don't think this next generation will tolerate a place that doesn't talk about it first before collectively making change in work structures, workload, time off, methods of requesting time off, ability to have other side interests. There's a lot of fear and also lack of information that many physician entrepreneurs and physicians in general for what other opportunities are to fill their cup. If they want to open a bakery, are they allowed to open a bakery? It's very interesting how different workplaces perceive that. And I'm curious whether you've encountered any of that with your clients or in your own journey.
Yeah, and I think even just with working with parents and kids, or it's like when I was their age, but I think it's just still looking at with these younger physicians that are just getting in there, let's just pause and hear their perspective. And of course, it may be that they still need some old school type learning to see how it is and how to really learn from those that have been before us. But yeah, just getting that whole perspective, right? To see what it means to, oh yeah, I can take some time for myself or open up that donut shop and yet still be a better me. Lillian,
Yes.
what have you seen as far as with the well-being curriculum that you've done? Were you there before the before and after, or what have you been seeing?
Yeah, I guess I've been through 3 epochs of change, just like you mentioned, the initiation of the work hours and being part of my initial projects when I was chief fellow was trying to figure out a different work schedule to see if that would make any difference and just to start to experiment. It's really interesting how the cultures, and that's why this new Stanford article, which points out that the culture is so important, there's such variation across professions, disciplines. It doesn't matter what specialty you are, like all of family medicine or all of orthopedic surgery or all of internal medicine or all of pediatrics. You go to different places and there's just the people make the culture, the expectations, the willingness to talk about things. And so I've seen things change over time, and yet one place is just one place. And when you have greater diversity, it helps you be able to implement and innovate, because you get new fellows from different places and they're like, we had this at our shop, or we tried this, or this really worked for us, or maybe this might work. And so the greater diversity of opinions and perspectives and lived experiences allows the well-being programs to be stronger. I think for us, a lot of it does come down to a lot of foundational lifing skills in terms of what taking the time out to think about your own goals. So I now sort of incorporate some coaching types of content into our curriculum. And also there's a lot of financial health. There's just a lot of financial basic literacy that is not really covered anywhere once you start working and making money. Ironically enough, I think in med school, they did like at least do a 101. But I don't know about you, a lot of people, even my colleagues and friends and my former graduates who are pretty deep into their career, 10 years, they're like, we don't have financial literacy. And it's an ongoing journey of learning and acquiring that. And I think that's another thing we do a disservice to with in training, is that we don't tell people, we don't begin the nugget of curiosity, and we don't continue to just normalize it. We're all always learning over time.
Absolutely. I think it's when I tell people, instead of getting a biology degree as an undergrad, if you're pre-med, is get business or finance, because that's a life skill that whether you have your own practice or you're working for someone else, Yes, it's the measures that we all have, but it's still how do you bill for that? And how do you bill appropriately? And how do those funds keep churning? So there is a reason for it. And I think we can fight it and say, oh, the measures, but it is the measures. Like we need the measures as guidelines to be able to get another grant or to get another to get more funds or what have you. But I think it's still being aware. I think going back a little bit to what you were saying about the article coming out and what you're doing there, we are evidence driven. And so when we see that it's happening somewhere, I'm like, oh, maybe it is something. So I think just being able to read those articles and hear from people like you that have been in there and to be able to share that evidence is awesome.
Yeah, it's fascinating. The fact that in the United States, at least, doctors provide care to over 1 billion patients yearly. And there's the average of 3.2 doctor visits per person. And half of those visits are actually made to a primary care physician, not include pediatrics. I'm assuming, to me, pediatrics is a primary care for children up to the age of, teenage years. At some point, they eventually have to transition to an adult physician. And most of these visits are 85% are adults, and 95% of children in America visit with a doctor every single year, which is really great. And yet at the same time, we've also had a persistent physician shortage. And so if you look at the Association for Medical Colleges, they have been predicting a shortage of up to 86,000 physicians by the year 2036. And we've seen a great exodus and actually greater flexibility and more part-time work. I think the bigger problems, the AAMC probably has underestimated this simply because of the creative and the flexibility now that many physicians are encountering to either do locums or to do part-time, because the demands are so heavy for what a full-time equivalent would be for a physician workload. Physicians don't really want to work over 80 hours like they used to. And I don't know that's a good way to operate. And so I think part of it is the HR, the staffing, the workload, and trying to figure out there's so many people that need to be seen and how to creatively offer that in a sustainable way for our careers. I don't know if you have any thoughts on that. As with your clients, they often have that internal struggle of, I really love my career. I really want to stay in whatever field. I just am not sure what I need to do now. I'm wondering, as a coach, what kind of questions do you ask someone when they first something's not quite right, but I still love it, but it's just too much?
I think it's coming up with that balance, that it's even if coaching is when we're looking at the wheel to see how satisfied are you with the way you're showing up professionally and family wise and everything. But I think it's if we can share with others that there's a way to do it, that you don't have to say no medicine because I'm not willing to work all those hours versus I really love medicine and I choose to have a family and I choose to do this. And I think it's going to start with us for us to say, I do want both. And of course, it's never going to be 50-50 or 100% in everywhere. But it's still, am I satisfied? And when I am working, am I with my patients and my clients 100%? And when I'm at home, it's tough, but still, can I be present? In that way, when I look back, am I going to say, I did, I enjoyed myself. I can't see my life not practicing medicine, but I have been able to make changes to say, I love what I do.
I love that. I know it's funny how I think becoming a mom made me really appreciate the different spaces that one could operate in. And now being a physician entrepreneur and doing coaching, I also appreciate everything so much more. That when I go in for my night shift, I am more mindful of what it means and the ability to have fun doing the things. I know it's not fun for everyone, doing procedures or running a resuscitation, but it's fun. You just focus on the little things and you wonder whether or not I just have the opportunity to keep up with science advancements, technology, new devices, new literature. I think when that's all you have, it can become more of a burden. We're like, I got to keep up with my CME. I got to do this. I got to do that. And now you're like, oh, there's just so much interesting things to read about, whether in the coaching science field, the psychology field, the business field, the medical field. I think in some ways by adding more, and there's only one singular focus, it actually helped me be more grateful for the different little identities I was holding in all those spaces. And I know it may not be true for everyone. I know that I'm just talking about my own personal experience, And at the same time, you never know, like sometimes just filling up that cup of doing your other things. I know for many physicians, back when we applied to medical school, we also loved photography or art or making. I remember there's a physician woman artist who makes these amazing silk screened scarves and she sells them and she has an online business and it's incredible and it's great. It fills her cup and is very inspiring to all of us because we remember the other parts of us. We're not just only a physician.
And I think it's as we also age and understand and do things, and sometimes it's experimenting with different hobbies to see it may not be that I have 10 hours to contribute to this, but how can I really have fun in this time? So yeah, just the wheel came up again, but just remembering that we do have the fun wheel and how that's really important too. Like we need to have fun and we need to enjoy, and fun is different for everyone. But when we're having fun, that energy is going to just improve so that we can also do, I don't know, I don't want to call it work, but still be play in that physician world or for healthcare professionals and still enjoy it.
Yeah. And so the wheel that Grizelda's referencing is something we do the very early part of our intake with all of our clients into our wheel of life. And many coaches have some kind of different inventory system for figuring out what might be off and maybe what we might want to work on. Sometimes we have clients that come to us like, I have no idea. I just heard amazing things about coaching. And so I just want to get started, but no idea where to begin. And so part of it is just getting awareness, getting an inventory, doing an assessment. There's different assessments, obviously, in the coaching industry. Some are more cognitive, some are more personality. Ours is an energy leadership index assessment. And they're all ways to take stock of where you are and where you might find your growth opportunity. It's funny how often we just get into our rut of just doing the thing and we don't know why something is off until we get a checkup. So it's just like it's like a life checkup compared to you get a physical checkup or you get a mental checkup. It's a checkup, basically. I don't know if there's other ways that you've described or in that initial intake time that you found with physician clients of yours, Grizelda.
I think that the biggest, the kind of the best feedback I've gotten from, especially with physicians or professionals, have been the whole part of learning about energy. So when we're debriefing that ELI, they love to hear how they don't necessarily love to hear how they're showing up in the lower levels, but they love to hear that the ability to shift and to say, wow, I could come in as a victim and conflict, but wow, if I could just go to that opportunity. So it's great to see when they get that aha moment to say, wow, I could really look at it differently and I can really show up differently and feel better. And it's a win for everybody. So I think that to me has been an awesome thing to see that shift with them.
Yeah, I do like our assessment because it allows people to recognize ways that they can do things differently, potentially either actions, thoughts, or feelings. And so it's really much more encompassing. And I think also for our executive physician leaders out there, we also have a 360. So that there's also an energy leadership index, not just for the individual. There's also one for how you show up in your whole life. And so when we are 360s, it can encompass also your relationships in your family, your nonprofit work, your business team, your peers at work, your executive C-suite, so your whole team. And so our 360s are much more comprehensive than the traditional corporate business ones you may often get from your HR. I just want to put a plug in for that as well.
Yeah, and it's pretty awesome to see because sometimes we're so close to it that we don't realize how we may be showing up. And if we come from curiosity to say, hey, my family does care about me, but they see me showing up as this. I'm curious to see how I can make a change in that area. So it's so valuable. Yeah.
I just want to also comment the fact that this episode releases during National Physicians Week, and we're grateful for the many organizations that are promoting and honoring the role of the physician. And our National Physicians this week is celebrated in 2025, March 25th to 31st. And National Doctors Day is March 30th. And the theme this year are Behind the Mask, Who Heals the Healers, and Together We Thrive, celebrating the power of unity in medicine. And so I'm curious, the themes for this year's National Physicians Week for you, Grizelda, what rings true as a practicing physician and coach for physicians and people in healthcare?
The thing is just still looking for how do we thrive together? It's how do we bring that awareness and acceptance and be able to just say, hey, I did choose this for a reason. And do I need to get back into my why, into my purpose? It takes work, especially with coach and definitely with organizations, but just to say, let's look at it a little bit differently. I think it's just the appreciation of everyone around.
I really like that perspective. Really healing the healer, healing ourselves first. Then is night and day for people who are more well and whole in your group and in your practice. For those listening, they may really resonate with that. Like they've been through a transformation themselves, or they've had a coaching experience, or they've actually had a life lived experience of oftentimes when we get sick too, things happen in our lives. We take care of other people, people die in our lives. And then when the other side is we are stronger and better with that. And when we have groups of other physicians and teams that carry us together, we're able to do that. And so whether you're in a moment where you can pay it forward and give it to somebody else in your group, I inspire you hopefully to remember that there's probably somebody in your group who could use a friendly hand. And also when you need it, they'll be there for you too, because karma is a good thing. Positive attracts positive.
Absolutely.
Any last parting thoughts for this episode, Grizelda, as we come to a close?
I think just finding that appreciation. I appreciate you, Lily, for what you do. And I think just finding that joy back and why we chose medicine and to still be able to show up. But I think we don't need just a week, but it's every day, kind of appreciating the process that it took to get us here and to keep going forward.
That's wonderful. Thank you, Grizelda. I appreciate you. It's really wonderful to find like-minded physician colleagues who are interested in helping all of healthcare prevent, hopefully, and recover from burnout and choose something differently with intention and be a better version of ourselves. And when we can do that, hopefully healthcare can heal. So thank you all for listening. And if you have any questions, feel free to please reach out and contact us. And if you want a topic covered on our podcast, please email our podcast at transforminghealthcarecoaching.com. Thanks, everybody.
Thank you.
Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.